Okay, let's be real. Parenting is not easy, but you're not alone. Welcome to the Parent Prescription, a podcast where I will give you real practical advice to help you navigate the ups and downs of raising healthy, happy children without losing your mind. Welcome back to the Parent Prescription. Today, we are taking a topic that causes a lot of anxiety for parents. Fever. Almost every child will have one at some point in their life, okay? A thermometer starts climbing and it's easy to worry about what's going on, but fevers are one of the most misunderstood symptoms in pediatrics. It causes the most stress. In this episode, we're talking about the 5 things that pediatricians wish every parent knew about fevers, what they really mean, how to treat them, when to treat them, and when it's time to call the doctor. My goal is to help you to replace your fear with knowledge so that you can feel more confident the next time your child spikes a temperature. Let's get into this dose of doctor. All right, so 5 things. Boop. I like using my hands. Here we go. Let's throw this out. This is not going to be a long podcast, but I do want you to understand a little bit more about fever, okay? So fever is, number 1, fever is not the enemy. So people get so concerned with the fever, the number that it is, what it is, the child has fever. Fever is not an enemy. That's the number 1 thing, okay? The fever is actually the body's adjustment to something that's going on. It's trying to fight off a virus, fight off an infection. It's saying, hey, something is happening, and so the body is increasing its temperature to heal, to help to heal the body, to help fight off what's going on. So actually, the response of the body is supposed to happen. And so the first thing that I want you to know, number 1, is that fever is not an enemy. It's not evil. Fever is a natural response to the body trying to correct something that's happening, okay? And so that's the first thing. A true fever is 100.4. I want to throw that out there because people will call and say, my kiddo has a fever and it's 99.2. I get it. The temperature is elevated. The temperature is rise, but a true fever is 100.4 or greater, okay? And the most accurate way to check that in a baby is rectally. You can do under the arm, you can do the scans, you can do the ear, but some people have a warm skin temperature anyway. They're just warm natured. And so if you are really concerned under the age of 1, do a rectal temp. For older kids, of course, they can do it orally by the mouth. But the number 1 thing to say is that fever is not the enemy. It is a natural response to your body trying to adjust to something going on, and it's helping you to fight something off. Okay? Number 2, fever is actually, the behavior is more important than the number on the thermometer, okay? And so a lot of parents will focus a lot on the number. It's, 100.7, it's 101 right now. I've got to treat it. It's 102. So the behavior, how is the child acting? Is the child still drinking? Is the child still playing? Is the child still eating and drinking and everything seems normal, or is the child laying around, falling asleep, not easily aroused? Every time you try to get them to drink, they're throwing it back up. What is actually happening with the child, not necessarily the number? Now, when you call, it's good, or when you call or when you come in, it's good for us to know like how high it's been getting, what's the range. That's good, but to focus strictly on, hey, right now the number is 102, and then in 15 minutes it was 101, it still hasn't gone back to normal. That's not the most important thing. The most important thing is the behavior of the child. Okay, number 3. Boop, here we go. Number 3. This is going to be a hard one for people to hear. Not every fever needs medicine. Oh gosh, I know. I'm going to stress you out even more, aren't I? Not every fever needs medicine. And so when we talk about a kiddo that's running around, active, playing, still doing everything, and you touch them and you go, whoa, wait a minute, come here. You feel warm, you feel hot. And you take a temperature and you go, whoa, it's 101, hold on. Do you need medicine? Well, the kid was just running around, playing and acting normal. No, okay, sit down, get something to drink, let's relax a little bit. I'll check it again in an hour and let's see what it is. Okay, not every fever needs Tylenol or Motrin. Those are good to help eliminate how you feel. And so if you feel bad when your temperature is going up, if you feel bad, if you're sluggish, if you are achy, if your body's achy, if your head starts to hurt because the fever is climbing too quickly, if there's other symptoms or signs with the fever, then treat it, of course. But if you just have a 101 and your kid's running around like normal, then just monitor the temperature, okay? Not every fever has to be treated. You're looking again at the way the child is acting, and the way that the reason to treat it is to make the child act and feel better, not necessarily treating the number, okay? Okay, number 4 is something that I hear more often than you would believe. Parents will treat the fever because they feel like it is going to cause brain damage. If the child has a fever, they'll get brain damage or they'll have seizures. And that's not the case, guys. That's not the case. It's one of those myths that is commonly heard, but that is super rare. You're talking under 105 degrees, 105. Anything less than that is not going to cause brain damage. The reason why some kids have febrile seizures, which is just in little ones, but the reason why they have febrile seizures is not because of how high the number got. It's how fast they got to that number. Okay, if a temp goes from 99 to 103 within a 20-minute period, then guess what? Some children, not all, will have a febrile seizure. Mostly that does not happen. And so when you talk about febrile seizures or brain damage, febrile seizures is a completely different subject because it's how fast the temperature rises, but brain damage is not happening under 105 degree temperature. Those are your stroke level, your heat exhaustion, your heat strokes. That's when you're talking about something like that happening, when the body temperature literally cannot come down and it's greater than 105. And so even though that it can happen, it's not common, and that's not usually with a virus or an illness, okay? And so kind of push that far away from your mind, is that I've got to hurry up and treat this fever so we don't have brain damage, or I need to run to the ER so we don't have brain damage or a seizure. Like, watch the child, watch what's happening, treat appropriately, but don't let that fear you into giving extra medicine when you don't have to. Okay? Number 5. When do I call the doctor? When do I call the doctor? My kid has fever. It's been going on for 24 hours. Do I need to come in? So, of course, the age plays a role here. If we've got babies that are running fever, they can't really tell you what's going on. It's good to go ahead and come in to your PCP, not your ER, to your PCP to get checked out. It could be ears, it could be urine, it could be a cold, it could be a virus, but it's good to go ahead and bring them in because they can't tell you what's going on, right? Now, most kids, if you know, will have viral symptoms if they're in daycare or a school setting. They can have fever, it can last for 2 or 3 days, and then it goes away. If they are reacting to your ibuprofen or your acetaminophen, your Tylenol or your Motrin, same things, guys. If they're responding to that and it comes back into a normal range and they go a few hours without needing it and everything is okay, they're eating, drinking, acting, and playing, there's no need to have to come in. Give them 2 or 3 days, and if it doesn't resolve, then come on in. However, the behavior is going to dictate whether they need to come in or not. If they're saying, I've got a fever and my throat is super sore, come on in, let us check the throat. My ears are hurting, I can't pee, it hurts when I pee. You know, if there's other things going, or they're just sleeping the whole time. They're tired, they're sleeping, you know, they're normally bouncing off the walls, but right now they're just laying down, and they've been laying there since they got out of school, and they've slept all night and didn't want to get up. These are reasons, the signs and symptoms to come on in. Let us check them out. It is the end, thankfully, of flu season. but we can still see things like flu and RSV and COVID. I mean, these things still exist. And so it's good to have knowledge about what's going on with your child. But if your kiddo's running and playing and acting great, or if you know that your baby is teething and they've got a low grade temperature or right at 100, 100, 101, and you just say, hey, I know that everything's been normal, but they're drooling like crazy and chewing on everything. It's okay to use the Tylenol for relief of pain, but not necessarily have to bring them in. Okay? So these are the main 5 things, the myths and the actual information about fever that will help you feel more confident when your kid spikes a fever, because it happens. It does happen. Okay? But when your kid spikes a fever, I don't want you to freak out or run to the ER or urgent care or even immediately call, because some fevers just last 24 hours and some last 3 days. Okay? But we can check it out anytime you need. I just wanted to give you the information so you can feel confident in treating your child and knowing when it is appropriate to treat. I hope you have a great week. Thank you for joining me on the Parent Prescription. Next week, I'm hoping to have a little one join me. I think that will be fun. But share, like, especially with people with little kids, share this with them, because fevers are always, usually the little ones are the ones that spike it on and off. Okay? But please share and have a good week. Thank you.